There's no problem with asking questions here, and this is an open forum. This is a safe space. I don't care how simple you think your questions are. It's all right. You can ask them, and I will answer them. You can also ask anything besides the ethical stations. I mean, it's not just bound to that. Okay, so let's begin by a simple approach to the ethical stations. So whenever you're going to approach an ethical station, what you need to do is you need to ask yourself, what situation are you in? I'm just gonna swaddle in between these slides. I'm not gonna go in sequence. So what I'm gonna do is I'm gonna try and present as many cases to you as possible. So you just get a general gist of how to tackle with each situation as it comes before you. So once you're in an exam, a situation is given to you, an ethical dilemma is, given. An ethical dilemma is presented in front of you. Sometimes it's a colleague, sometimes it's okay. So can everyone hear me?
Yeah, Dr. Daniel, we can hear you. Thank you.
Yes, doctor, we can hear you.
Okay. So sometimes in the exam, there are ethical stations. Sometimes there are more than one ethical stations. In the exam, you're presented with a situation. Okay, so the situation is either going to be a colleague, it can be an angry patient, it can be an angry attendant as well. Sometimes people with the patients, they're angry. Sometimes the information is not being shared with them. Sometimes they want to request something. Sometimes it's a discharge on request. Sometimes it's a lab results gone wrong, lab results gone missing. The whole point of these stations is to test you for pressure situations. You are going to work in the NHS. NHS is overly crowded. It's overly burdened. So what the GMC wants to do is make sure that you are ready for pressure situations. Because sometimes during the night shift, on a 12-hour shift, you're going to be alone. There is not going to be that much support. Your consultant is not going to be awake all the time. So you're going to have to deal with these situations on your own. So that is why ethical dilemmas are obviously, going to be very important when it comes to PLAB 2 and in real life as well. So, for example, you have an ethical station. You go into the exam. And you have an, ethical station. Sometimes, let's just say it's a colleague. There are many famous stations when it comes to ethical scenarios. Sometimes it's a colleague doing drugs. Sometimes it's a junior colleague coming in late, and on and on and on. They can modify it as much as they want. It's a very wide range. So let's take the example of an angry patient. So there is a case where a mother comes to you. Her child is admitted in the hospital for pneumonia, and an IV line is to be passed to the child. So it's a very plain and simple scenario. The problem arises where the junior doctors and the nursing staff both have tried on the IV line and both have failed on their multiple attempts. So now the mother is concerned. Sometimes what they will do is they will also introduce the fact that the child has cerebral palsy. So now you have a sympathetic, element to that as well. So the mother is overly concerned that her child is, suffering from a genetic condition. So once you get into the station, what you will see is a mother, and she will be extremely concerned, extremely worried. She will be like any mother would be in that situation. She would be very, very angry. You walk in and she'll just go off on you. So what happens in that situation, most of the students, what they do is they panic. So rule number one for ethical stations is do not panic. Even if the actor or the patient there is screaming at you, you take it. You take it slow and you listen to what they have to say. The most important part of intrapersonal skills is listening. You do not interrupt the patient in between. You do not cut them off. And once they are done, You wait for them to be done, and then you speak. And when you speak, you start speaking very politely. All right? So the when and the why is very important. When is this happening? The when means, what situation are you in? Are you alone? Are you with a consultant? Are you, a senior doctor? Are you an FY2 in GP? Are you an FY2 in a hospital setting? Is the patient admitted or not? The second point is, why is it happening? Why is the patient angry, or why is the attendant angry? They are going to be angry at some faulty procedure. They're going to be angry when something deviates from the normal. You need to realize that before you approach the station. All right? So let's move on to the next slide. The do's and don'ts. I think I've already covered those, but again, the do's are, the do's are going to be, you're going to listen. The do's are, the do's are going to be, you're going to listen, and you're going to listen very intently. And you're going to listen like it's the one thing that can save your life, honestly, because at that time it probably will. And the don'ts would be, do not cut the patient off. Do not try and, be smarter than the patient. All of us know you're going to be smarter. You're the doctor in the scenario. You are going to be smarter than the patient himself. But what you need to do is, you need to take that smartness, you need to take it down a notch, and you need to explain in the simplest terms possible. And you need to be very polite while doing that. Otherwise, your whole IPS system, it's going to fail. Your interpersonal skills are going to get a 0. Without the interpersonal skills, you're not going to pass the station. It's as simple as that. PLAB 2 is basically an exam of interpersonal skills. It's not an exam of knowledge. Everyone needs to remember that. What they wanted to test was knowledge. What they did was they gave you the PLAB 1 exam. They tested your knowledge there. It's done. They know you know your stuff. What they don't know now is how good are you at sharing that information with the patient and the people around the patient. Okay? So it's an exam of interpersonal skills. Focus on your interpersonal skills. If you're not good with those, you're not going to pass your PLAB 2. It's as simple as that. So this is one of those cases I was talking about. This is a case of cerebral bleeding. So a patient comes to you with bleeding. It might be an accident. It might be, some sort of a traumatic event. If it's an old patient, it can be a subdural hematoma. So they can basically give you any type of cerebral bleeding. Now, what happens is, sometimes in these scenarios, there are 1 or 2 scenarios, they keep changing it around. So in these scenarios, what the patient does is, sometimes it's the patient's attendant who is demanding for information regarding the patient. There's a very famous case of cerebral bleeding. The surgeon, what happens is, it's his mother. The scenario goes on like a woman patient has come in, and her son is a consultant working in the NHS, but in some other trust. So you're an FY2. Once you go in the station, the scenario is that the son is demanding to see her mother's CT scan. So obviously, he's not allowed. According to the ethical guidelines put forward by the GMC, put forward by the NHS, no one is allowed to see a patient's personal file. But since he's a consultant, he asks for a special favor, if you want to call it that. So once you get in the station, he is going to be very angry. Everyone has stopped him to see his mother. He cannot see his mother. He's very angry. He's very frustrated. He will jump on you. And I am not kidding. He will literally jump on you. You walk in, he's standing, he is fuming, he's pacing around the room. You walk in and he just flips on his angry switch and he goes on, who are you? Where's your consultant? I don't want to talk to a junior doctor. I'm one of the general surgeons here in that hospital or that hospital. So That station actually was in my PLAB 2 exam, so I have attempted it, and it's no joke. You get scared. So what happened to me personally was, I like personal encounters, I like telling them. So what happened to me was, I tried to convince him that it was against the guidelines to let him see his mother. Because obviously you cannot, it's confidential information put forward by the trust. What he kept saying back to me was, I do not want to talk to a junior doctor. I don't care who you are. I don't care what the guidelines say. It's my mother. I'm going to see her. I know more than you. I'm a consultant at the NHS. And obviously you cannot argue with that. He is a consultant in the NHS. You are an FY2. You're basically nothing in front of him. You're just a cog in the wheel. He's basically the one running the wheel. So in these kinds of situations where the patient is angry, there are certain precautions you need to take. One of those precautions is if the patient or the one actor in the scenario, in this particular scenario, he is going to be in a standing position. You do not sit before him, and he does not sit. So the whole station is kind of in an awkward situation where he is standing and talking to you, and he's very angry, and you're standing in front of him trying to figure out, just to have him let it out on you, and then you're going to speak. If you cut him off, you fail the station. If you sit before him, you fail the station. If you invite him to sit and he does not sit, that does not mean you fail the station. That just means you're still trying to convince him. So you're going to be very polite with him. You have to be polite with him, but you have to be a little bit, rigid in your situation. He's also going to ask you, go back, call your consultant. I want to talk to your consultant. If you do that, you fail the station. Because as an FY2, it is your job to handle this yourself. All right? So if your consultants are basically busy, they're busy dealing with his mother or busy dealing with some more important matters, they cannot deal with this. This is basically, less important than dealing with an acute emergency, like a cerebral bleeding or trauma. So you're going to assume that your consultants are busy back there working in the hospital, and they have sent you in their stead to talk to this senior doctor. So moving on, you're going to talk to him. So he's going to be very angry. You're just gonna, have him at you. You're just gonna be his punching bag. Once he is done, every time he says, call your consultant, you're going to say, yes, I will call my consultants in a bit. What I want you to do right now is talk to me. They have sent me in their stead, and I'm more than capable of dealing with this. So please let me know whatever problems you're having. What's your concern? All right. So he still stays angry. Sometimes he sits. If he sits, you sit down. Sometimes he keeps standing. If he stands, you stand. End of story. There is no other opinion about that. So personally, what I did was I kind of got frustrated. It was getting nowhere in my own station. So what I did was I just went very straightforward with him. So I went on saying that, sir, respectfully, and I'm being very respectful here, you're one of the senior consultants working in the NHS. So obviously, you know the guidelines better than I do. And if you know the guidelines better than I do, and I know you know the guidelines better than I do, you also know that we are not allowed to share the confidential information of a patient with an outsider until a power of attorney is shown. Okay? So what I would like you to do is I am going to help you in any way I can. I am here for you. What I can do is you can give your number to the nursing staff or the HR. And once your mother wakes up, once we have confirmed your identity, once we have taken her permission, we will call you, and then you can come back and I will tell you how she's doing and what her scan results say and whatever you want to know, whatever questions you have. So it was a very bold move on my part. I'm not a very bold person. It was a very bold move on my part. But he seemed to be, he seemed to understand this, and he calmed down afterwards. So sometimes the boldness works, If you have any other ideas, you can also apply them. I mean, it's a very open concept. So that's about the the cerebral bleeding stations. So it's again the same thing. The slides continue: patient level of consciousness, whom to talk, what to talk about. The point of this slide is that the patient is unconscious, and who are you going to talk to? So what we said was that we're going to wait for the patient to wake up. When she wakes up, we'll talk to her, we'll confirm your identity, and then we will move on to the information you've requested. So what to talk about? You can talk about the general health of the patient. So in this particular scenario, what you can say is, your mother is fine right now, but I cannot tell you the exact details of her condition. I cannot tell you where the bleed is. I cannot tell you what the CT scan report says. Okay, and what you can do in this condition, this is a very clever maneuver, this one, another medical condition. What you can do in this situation, if you're being extra confident, if you're being, extra vigilant, what you can do is try and ask about any other medical conditions his mother has. So what happens is you're basically counseling him and taking the history alongside. So if you can do that, that's a plus point. If you can't do that, that is not the point of the station. So don't focus too much on that. Focus on the task at hand. If he says talk to the patient, you talk to the patient. If it says counsel the patient, you counsel the patient. Read the last line outside your station very well. Live it, learn it, that's the one thing they want you. If you go off of the task, the whole point of the station is lost. So then we have the disclosure of newses, the good news, the bad news. Sometimes they're going to present to you a scenario where you have to break the bad news, where a person has tested positive for HIV. Sometimes what they're going to do is they're going to put other bad scenarios like, an accidental traumatic event. In these kind of scenarios, what you need to do is you need to educate the family members. Most of the times they're very educated, but sometimes they're just, not that, knowing about the condition. So you're going to have to educate them about the condition in the simplest terms possible. All right. And once you've done that, once you've achieved that, it's all, going to be very easy afterwards. So once you educate them, you counsel them, you ask for any supportive treatment for the patient. What they're going to ask you, what can we do for the patient? What you want to do is you want to counsel them that we're doing all we can. We're giving them medications. We're giving them the IV medications, the oral medications. We're doing physiotherapy for them. What you can do right now is to be supportive for your patient. And then you can discuss the prognosis, whatever the prognosis is, whatever treatments you can give. That's a very standard management procedure. I don't think I need to talk about it that much. So moving on, this is another case where Mr. David has had an ischemic stroke that has affected his left side. He was recovering and then he developed another stroke.
Hello, doctor. I'm not listening you.
So we know the good name, please. Who is this?
Could you repeat, doctor?
Can you please hear me?
Yeah, now it's clear.
Okay, it's clear. Anyone else who is facing any difficulty with hearing? All clear? Yes, I guess there is some internet issues on your side. Guys, please connect your devices with the audio. Thank you.
I think Mafia Med Expert, he has lost the connection.
No, actually, I'm here. There is some internet issues on Dr. Daniel's side. So
Yeah,
just,
maybe. Yes, yes, sorry.
yeah, it's totally fine. Just continue the session. So who wants to present the station first? Anybody wants to present in the session? Mohammed Saad, can you please connect your device with the audio so you will be able to hear? Backend team, can you please help Mohammed Sadur Rahman? Thank you.
Sorry, are you asking to perform this station, being a doctor or being a patient?
Yeah, I'm just asking to present a station being a doctor. Moreover, Dr. Dada will guide you. Just give us a second. He'll be back.
Sure.
Yeah, please wait. Once Dr. Dana will be back, you will be able to hear. Okay. Thank you. We are connected with Dr. Daniel. He is coming back in 2 minutes. Thank you.
Hi, sorry everyone. I had a power outage. Can everyone hear me fine?
Hey, Dr. Daniel, welcome back. Yes, we can hear you. Thank you.
Okay. Sorry about that. Here we go.
So our backend team is here to help all those who have any issue regarding their audio or any connecting issues. Yeah, thank you, Amna, for connecting. Please help them all. So in your absence, Dr. Daniel, I was asking the students who wants to present. So we have 2 or 3 volunteers who wants to present the station. So you can continue further. Okay, thank you.
All right. Thank you. Thank you so much. It's really nice that people want to represent. That's very nice. Always remember, people, always keep practicing, even in your sleep. PLAB
Yeah,
2
it's a
is
key point. Exactly. It's the key point to, pass your exam in one go, because stations is all about the practicing.
but don't practice too much. Have some time off in between.
Yeah, exactly. Okay, let's ask the students who wants to present first.
Yeah, sure thing. Okay, guys, who wants to present first? Please turn on your mic. Okay. Hello. Is anyone going to present? The volunteers, one of the volunteers, please raise your hand, I guess.
So do we have anybody who wants to present, please?
Nobody wants to present, really, I think. I think they
Actually,
volunteered out of I think they
yeah, in
volunteered
your
out of
absence, many
curiosity.
of them are saying that they want to present. So how gonna you will pass your exam if you are shy at this stage? I don't know.
I can, sorry, I'm interrupting. I can do, but I'm a very beginner in PLAB too. I seriously, I don't know anything.
Oh, don't worry about it. Everyone's a beginner. I mean, we all have
Yeah,
to start somewhere. Don't worry about it.
yeah.
Okay, so Dr. Mukherjee. Okay,
Oh,
so Dr. Mukherjee, I have just explained the station to you, right? Were you listening to where the surgeon has his mother admitted in the hospital?
Yes.
Okay, so I'm going to be the surgeon, and you are going to be you are going to be the FY2. Does that
Okay.
sound good?
Okay.
Okay.
Is it not
So
the case 2? Is it that's okay? No problem. Yeah.
this one. Is that
Okay.
okay? Okay.
Which station do I need to present? Like Breaking Bad News one?
Yeah, not the breaking the bad news, the cerebral bleeding I just explained now. The one where the consultant, there is a consultant surgeon. I'm actually going to read the case out loud to you, okay?
Okay,
So
please.
listen carefully. So you are an FY2 in the geriatrics department.
Mhm.
A patient has come to you with a cerebral bleed. A CT scan has been performed, and the patient is now admitted in the hospital and is being treated. Once you're
Okay.
in the hospital, one of the HR informs you that there is a visitor for the said patient. He
Okay.
claims to be her son. Go talk to him. Your task is go talk to the son and see what he wants. Okay?
Okay.
Okay. So once you're ready, we'll start.
Hello, I'm Dr. Mukherjee. I'm one of the doctors working in the geriatric department today. Can I confirm your name, please?
I don't care if you don't know my name. I want to know how my mother is. Where's my mother? Can I see her? I want to see her. Where's her CT scan?
Well, can I, if I am able to know your name, then I can address you properly. Otherwise, can we have a seat and talk in peace, please?
No, we cannot have a seat. My mother is sick and you're here playing your games. Who are you? Are you a junior doctor here?
Yes, I am a junior doctor here.
Well, I don't want to talk to a junior doctor. What I want is a consultant right in front of me right now. I am a consultant. I am a general surgeon in London's Queen Mary Hospital, and I demand to see a consultant. I don't want to be disrespected this way. Get it?
I am.
Go back, call your consultant. I'm not going to talk to a junior doctor.
I'm really sorry, like how you are feeling that way. But my consultant is busy at this moment with the seriously ill patients. So I'm on behalf of on behalf of him talking to the patients now. So can you please tell me what exactly happened?
Oh my God, I'm going to have to talk to junior doctors. Okay, do you know what a CT scan is?
Um, can I ask you a couple of questions, like so that we can have better discussion?
What I'm asking you is, can I see my mother's CT scan? Actually, I'm not even asking, I'm demanding. She's my mother.
Yes, I can.
What does her CT scan say? You know, is she sick? Is she going to live? Is she going to survive? What's going to happen?
I'm sorry, sir. If you are I can totally understand that you want to know about your mother's condition, and you want to know about your mother's CT scan, what exactly it's saying. But we are not supposed to disclose any part of the patient-related information without patient's consent. As you said that you are consultant, senior consultant in London Hospital, so you must be you know more than me. I do more than me that without patient's consent we are not able to say or disclose any part of the patient-related information.
Child, I am her son. You're not going to tell a son that his mother, whether she's sick or not, and whether she's going to survive or not. I mean, come on. And I'm your senior. You do as I say. Who are you? How does an FY2 even talk to a consultant here? What kind of hospital are you running?
I can see that you are a bit upset about you are not able to see, or you are not able to know about your mother's condition, and you are very much anxious. But as I told you earlier as well, without patient's consent, I'm really legally bound not to disclose any part of the patient's related information.
Okay, can you just at least tell me if she's fine or not?
I'm really sorry, sir, because as you are my senior, right? With all respect to you, but I'm not able to disclose any part of the patient-related information without patient's consent.
Okay, so how do I get to know what she's going through? Okay, you tell me then.
like we at this moment we are we are dealing with the lady, so we are dealing with the patient, and we are treating her, but I'm going to go to the go to see through see all the notes and everything, and then if you can give your name, contact details, and your phone number to the nursing stations, then we can get back to you, and we can give you all the information once we have gained the consent from your mother.
Good. Nice one. How, you said you were a beginner in PLAB too. How exactly are you a beginner?
No,
these are
that was me. That was me. Sorry.
Oh, sorry. Okay. So, Dr. Mukherjee, you were nice. I just have one or two pointers for you.
sure.
Uh, Number one is try to breathe. Okay. What happens is when you're talking too fast, even I'm doing this right now. I had to, get over this thing on my own.
Okay.
So what you do is when you're talking trying to talk very fast, okay, your brain is not exactly working as fast as your mouth.
Okay.
So that's where the comes from.
All right.
Okay, we do not want the gaps between the talk. So what
All
I
right.
want you to do is I want you to be, take a deep breath, be very calm, be very polite. You were very polite with this. You just need to work on it just a little bit more. You need to be, more convincing.
Do you want me to pace down a little bit for my performance?
Yeah,
Like,
be just a little bit slow, not too slow because it's only 8 minutes. But you
okay.
see how I'm talking to you right now.
All right. Okay.
Okay, you just try and do this whenever you are not thinking properly, whenever you are at a loss of words. So instead of using fillers like you know, these don't look good mid conversation. These look good in an informal conversation. These do not look good when you're attempting a station where you're being recorded by 3 different cameras. Okay.
All right.
So
How was my IPS? What do you think?
your IPS was very nice. You were very polite. I would give you a 3 out of 4 on a good day, and on a bad day, I would give you a 2.5 out of 4. And why I would give you a 2.5 out of 4? It's because of the gaps in between the conversation. You were talking too fast, okay? But
All right. Thank
sometimes
you so much.
there were moments when you were not making sense, okay?
All right. Okay. Understood.
Okay.
Thank you so much.
No problem at all. Okay, so guys, you have seen, one of the cases. So Dr. Mukherjee, he's not going to tone down. I toned down because I had to save on some time, but he is not going to tone down. He's always going to be angry until you are very straight with him. So you went on, and you were straight with me, and the second you went straight with me, I toned down. So this is how this scenario is going to work. Okay.
Okay.
So now, where were we? Yeah, we were at the good and the bad news. I don't believe there are scenarios having good news with the GMC. There's always bad news. So breaking the bad news is always going to be a tricky one because you have to keep your patient aware of the facts, and still you have to be emotionally supportive. Okay, one thing I would like to add, everyone, uh, everywhere around the UK and all the students who are preparing for PLAB, they keep saying these, I used to call them catchphrases. One of the examples are, "Hi, my name is Dr. This. How may I help you today?" These are very, common catchphrases. Another one is, "I can understand how you're feeling." So sometimes in a very difficult situation, you are talking to a patient and you say, "Oh, I'm so sorry to hear that. I can understand how you're feeling." And then the patient just flips. He would reply you back with, "Doctor, you do not have the disease. You cannot understand how I'm feeling." So that's where you feel like you're stuck. You're in a sandwich. So instead of using these so-called catchphrases, they're very common, they're very typical. The GMC knows these phrases. They've been conducting examinations for the past 10, 20 years. They know all the catchphrases from all the preparation centers. You need to be unique. So formulate your own catchphrases, the ones that are unique to you. A suggestion would be, you know, hi, hi, my name is Dr. Daniel. I'm going to be taking care of you today. Okay. So, hi, my name is Dr. Daniel. I'm here to help you out today. So, what brings you to the GP clinic, or what brings you to the hospital? Okay. Just try and modify these catchphrases. These catchphrases would reflect that you have actually thought about the station and you have actually done some, work on your interpersonal skills. You're not just revising a script. It seems very scripted when you say, I can understand your situation. You cannot understand the situation. You don't have, God forbid, you don't have HIV. You don't have, cancer. How can you understand the situation? You can't understand the situation. So I can imagine how you're feeling. Or I can see that you're distressed. Dr. Mukherjee used that. That was very nice. So I can see that you're distressed, but may I suggest this? Or I can imagine how you must be feeling. So, but what we can do for you is this, and that. Okay, so continuing with the station. So we had a patient, a 65-year-old. He was admitted with an ischemic stroke on his left side. He was recovering, and then he had another stroke yesterday, and his GCS is now 3. So a 3 GCS means that he is a potato. So they did a CT scan and showed a massive clot in both the hemispheres. Only analgesics and IV fluids can be given. If the patient deteriorates, then it is DNAR. Do not attempt resuscitation. Now his daughter has come to you to discuss her father's condition. So what do you do in this scenario? You're going to have to, number 1, talk to the daughter. Number 2, she does not know that her father is now on palliative treatment. You are not going to resuscitate him. If he starts to deteriorate, you're going to let that happen because that's what the multidisciplinary team has decided. Okay, you're only an FY2. You do not go against the MDT. So you're going to have to talk to her. You're going to have to reveal to her her father's condition. And then what they want you to do in those 8 minutes, the cruel GMC, they want you to, make her okay with her father's death, that he is going to die. So you have 8 minutes to do these 3 things. So once you walk in the station, you see a young lady, a very worried young lady. And the second you walk into the station, she gets up from her chair and she comes to you. Doctor, how is my father? Is he going to be okay? I heard he had another stroke. How is he, doctor? Now, this time the scenario is a bit, flipped. Previously, we had an angry patient or an angry attendant, to be more exact. Now we have a very concerned attendant. So you approach the station very politely. Again, you say your greetings. You say, first of all, hi, my name is Dr. Daniel. May I confirm your identity, please? Okay, so that's how you break the ice. Or what you can do in the start is you can validate the patient's concerns. Yes, I am Dr. Daniel. I'm here to talk about your father's condition. But before that, may we have a seat, please? So what you have done by saying that is that you have made sure that she is seated. You have told her your name. And now the second part is you will confirm her identity. Sorry. So how do you confirm her identity? May I know your name, please? Very politely, very softly, but loud enough that the examiner can hear you. She's going to tell you her name. It's sometimes Michelle, sometimes Meredith. Names really don't matter. So the next part is, and how are you related to Mr. David, or whatever the patient's name is? She's going to tell you, I am his daughter. Okay, and what do you know about his condition? She's going to flip on and she's going to say, yes, doctor, I know he was admitted here with a stroke. He was paralyzed from the left side, but, I received a call from the hospital. They said he was sick. I just, came running. I'm very tensed. I have 2 children back at home, and I'm very tensed. I'm very frightened, and I'm very tensed. So, how do you approach this? You validate her again. Yes, I can see that you're very distressed, and I am here to talk about your father's condition with you. But before we go on, can I ask you a couple of questions first? Okay, so that is the history taking part. She will agree. She has to agree. I mean, it's kind of her in her script. So if you say that, she's going to agree. Yes, doctor, you can ask me some questions. Okay, so how long has your father been sick? Okay, doctor, he's been sick for this period of time. Okay, and he does. You take a very quick history. So, when was the first time he presented with symptoms? Has this ever happened before? Has he ever had a stroke before? Okay, does he suffer from high blood pressure, high blood sugar? Very, very quickly. You take a minute or 2 minutes and just skim through it. Because the whole point of the station is management. The history taking part is you doing your job as a good doctor, and also you have to show GMC that you have got the skills. So you go there, okay. So now you told me everything I've asked. So do you have any questions regarding the condition of your father? Yes, doctor. How is he doing? Okay. I'm afraid he's not doing very well. And sometimes she'll start crying. Sometimes she won't start crying. Depends really on the situation and how badly the actors wanna, mess with you. They're not good people. They mess with you a lot. So if she cries, you're going to console her. How are you going to console her? You're not going to give her a tissue paper. Honestly, people do that. They imitate having a tissue box. This actually happened. One of my mates, he imitated that he had a tissue box, and he pulled an imaginary tissue out of the tissue box and he gave her to the patient's attendant. And here, take a tissue. And she was like, "Where's the tissue, doctor?" Yeah, needless to say, he failed that station. So don't do that. Do not give her an imaginary glass of water. Do not give her an imaginary tissue paper. Do not give her an imaginary napkin. Do not give her your own napkin from your own pocket. Okay? Don't give her anything. Just console her. So what you're going to say, you're just gonna let her cry for like 5 seconds and be like, "Are you okay? Do you need something? Can we do something for you?" And she's gonna stop crying. After 5, 10, 15 seconds of wasting your time, she's going to stop crying, and then she's gonna pick her head up, and then she's gonna start talking to you again. Then you start, unloading the whole stuff on her very politely again. So as you know, your father came in with a stroke on his left side. He was recovering and he was doing very fine, but unfortunately, he developed another stroke yesterday. And now there is something that we assess the consciousness of the patients on. It's a scale, it's called the Glasgow Coma Scale. The normal value for that is 15. You are 15, I am personally 15 on the Glasgow Coma Scale. But your father, unfortunately, he has scored a 3 out of 15 on the Glasgow Coma Scale. So he's not doing very fine. We also did a CT scan. We ran some investigations. We did a CT scan, and it showed, unfortunately, a massive clot in both the hemispheres. So we had, all the senior doctors and all the senior consultants, all the King's forces and all the King's men, basically. So we had them in a meeting. It's the multidisciplinary team. It's the MDT. So they discuss your father case. Everyone discussed your father's case, and we decided at the end that what we can do for him now is not much. We can make him pain-free, and we can give him IV fluids if required. Other than that, I'm afraid that there is not much we can do. So that's your whole line of explaining what has happened. And then she is going to ask you the $1 million question. Doctor, is he going to die? So I'm afraid you don't just say he's going to die. I mean, that's just rude. I mean, come on, who says that? So what you're going to do is you're going to take this again technically. Everything in GMC, in PLAB 2, everything in the GMC, everything in PLAB 2, it's all, it's like it's a circle. You just run round and round and round. You never really get to the center. So again, you're going to run round and round and round. How are you going to do that? Yes, as I previously mentioned, he's not doing very well, and his Glasgow Coma Scale is 3. So I'm afraid that there is not much we can do, and in the end, there are very high chances that he may not make it. Do not say the word die. He may not make it. Okay, so she's gonna start trying again. Maybe sometimes she doesn't do that. Depends on the actor, depends on what they've been given. So what you have done is you have counseled her. If she cries at the second point where you say he's not going to make it, there are very high chances that he's not going to make it. If you say that, and if she starts crying, you again let her cry for a few seconds, and I can see that you're distressed. Now there is one question that I would very much like for you guys to ask the patient if the scenario comes in your exam. Did you come alone, or are you here with someone else? You can ask this question initially at the very beginning of the station. Okay, that's kind of the thing with the Breaking the Bad News stations. You can swap it up. Okay, so if you're going to ask it in the beginning, what you're going to do is, hi, my name is Dr. Daniel. Yes, I'm here to discuss about your father, but may we have a seat before we discuss anything? Okay. May I ask, may I ask you a few questions first? Okay, so did you come alone? Okay, and is there someone who can pick you up? Stuff like this, stuff that makes you seem emotionally available. You can also do this towards the end. If at the second point she starts crying and you said, "Are you okay? Do you need any help? Do you need us to call someone for you? Did you come here alone? Can someone pick you up? Can we arrange a transport for you?" I don't know if the GMC does that, but we were told that if you ask this, it's nice manners. Okay, so that's pretty much it about these kind of stations. Okay, there are a lot of stations like this. So moving on, that's the approach: breaking the bad news, talk to daughter, and sometimes the patient's daughter is also pregnant, so you have to consider that as well. So initially, you can ask, okay, and how is everything at home? How is everything going on in life? How has your father's illness affected your life? And then she might mention, yes, doctor, I'm pregnant. Okay, congratulations. How far along are you? Sometimes she says 4 months, sometimes she says 7 months. So you need to be, the whole point of her being pregnant is the fact that you need to be polite. What they want to check is your interpersonal skills. I keep saying that again and again. If you can master your ethical stations, you can, pass your PLAB 2 in a single go with no problems at all. What they want to check is your interpersonal skills. Never compromise on your interpersonal skills. Use your hands, use your face, use your facial expressions. Everything about you should scream that you care for the patient and you care for the attendant. Okay, this is basically the one, all of the stuff that I've already explained. How can you explain the condition of the father, address her concerns? MDT has decided surgery cannot be done. They've decided only palliative care. Okay, this one, the next case. This is the case more famously known as the Joshua case. The Joshua case is a fear factor among all the PLAB students. You should learn to fear the station, but you should know how to tackle it. In this scenario, there has been a road traffic accident. So the scenario is basically that a young child, sometimes he's 5 years old, sometimes he's 4 years old, he has been brought into the emergency department. You're an FY2 in the emergency department. The child has come in, and now he was diagnosed sometimes with a bleed in the brain, sometimes with a broken bone, sometimes with a broken facial bones or a broken humerus. More commonly, it's the broken humerus, or sometimes to go with the tibia or a fibula. So the point is the child has fractures, a lot of fractures, sometimes a single fracture, sometimes has multiple fractures. The whole point here is to deal with the parents. So you're going to have to take a history from the parents. You're going to have to counsel them. This is a mixed scenario where the parents are very angry. Nobody has told them what's happening with their son. They are frustrated at the health system. They are frustrated at each and every single doctor in the hospital. They feel like they are not being helped. They are not being told about the condition of their child, and they are worried sick. So this is the kind of patient you avoid in real life. It gets very volatile. So this is a particularly hard station. You're going to have two attendants once you enter the room. One of them is going to be sitting and one of them is going to be standing. The one standing is going to be Joshua's father. The one sitting is going to be Joshua's mother. The mother will be looking at you, very inquiringly, and Joshua's father is going to be angry, and he is going to be as angry as the surgeon I've told you about previously. So you walk in, Joshua's father jumps at you. So you go and you introduce yourself. Hi, my name is Dr. Daniel. He cuts you in between and he says, "How is my son, doctor? How is my son? Is he going to survive, doctor? Doctor, nobody's telling us anything at all. We're worried. What kind of hospital are you running? I mean, come on, nobody has told us anything about our son." So you let them speak. The same approach goes. You let them speak their mind, and you very calmly, very politely ask them to sit down. How do you do that? "Yes, I am here to discuss about your son. But before we do that, may I please ask you to sit down?" And he will reluctantly sit down. "Okay, I understand that Joshua. I
Hi,
understand.
Dr. Daniel.
May I confirm?" Yes.
Yes, Dr. Daniel, there is some issue on your side in the voice. There is some distortion. Can you please check it now?
Yeah. Is it fine now?
No, there is still some distortion. Can you please reconnect to from some other device, maybe? No, it's fine now.
Okay. It's fine now.
There is distortion again.
Just basically.
He is near to some any other electronic device, I think.
Yeah, maybe.
Yeah, I am actually. Sorry. Is it better now?
No.
Just change the device. Yeah. I hope it's fine now. Yeah. How about now? Guys, can you hear me? Still? Okay. Okay. I'm just gonna change the device. Please give me a minute. I'm just gonna change the device. Hello. Okay. There's a background noise. Okay. Okay. Just. Hi. Can everyone hear me fine now? I hope they can. Wish you can. Is the audio good, guys?
Yeah, it's better.
It's better? Okay. There was actually, there's a child at my house and he likes to watch cartoons. Okay, so let's move on with the Joshua station. There are basically a lot of stations here in this PPT slide. So if you guys want, I'll share the PPT slide with you because these are just the general approaches to the cases. What I basically wanted to do was to give you a general layout of how to approach the ethical stations. After this, I'm just gonna skip to the part where you're gonna have to deal with the colleague. These are the 4 or 5 very important stations. So the whole point of this interaction is to let you guys adapt to the fact that there are going to be ethical stations. There has not been a PLAB 2 exam where there are no ethical stations. There's always 2 or 3 ethical stations. Yeah, sure. Let's wind it up. And am I this boring, guys? Really? Am I boring?
Sir, one question can I ask?
Yeah, sure thing, buddy.
Okay, sir. In angry patient or attendant stations, if the patient is so much angry and not letting the doctor to go ahead, so like we did in the previous case, will it leave bad effect on the marks or overall on the station? Because we have only 8 minutes and quite enough time was consumed on just greeting or just only 2 or 3 sentences.
Okay. The GMC, what they do is every station is optimized. When I say optimized, it means that the actors they have hired, they are professional actors. They have been doing the examinations for years. And they're not just hired, they are trained beforehand. Okay? There is around, 3-4 months of training, letting them know the pattern of the examination and letting them know what they can do with the station, how much flexible can they be. Okay, so they will not deliberately waste your time. All right, in any angry patient station, if the patient is speaking too fast, too loudly, they are not allowing you to talk. They are bound by law, they are bound by GMC law to give you a window. Okay, they will give you a window. They are instructed to do that. Once they give you a window, the whole point of me presenting the case in front of you was they will give you a window. What you need to do is you need to identify that window. Okay? That is why I keep saying very calmly and very politely, do not get panicked. The second you start panicking, they will overcome you. And they keep giving you opportunities, honestly. One of my stations, I was, during my actual GMC exam, in one of my stations, I got stuck at, I remember not much. I think it was the management. I was stuck in the management somewhere. No? So what the actor did was, the second I stopped talking, she was like, "Doctor, don't you want to ask me about, my health conditions or something?" And then I remembered that I had forgotten that what question while taking the history. So what I did was I completed my history, and sometimes they help you, sometimes they're very nice. Okay. I'm sorry. I am trying to speak. It's on my microphone. It's basically my gaming headset. It's kind of a tough situation. Is it okay now?
Okay, sir. Thank you, sir.
Okay. I'll make my volume up. Okay. I'll just start talking louder. I mean, this is as far as I can go. Ms. Biswas, yeah, I'll definitely try that. I'll just try speaking louder. Okay? Okay, so what I'm going to do is I'm going to give you a case with Joshua. So again, Joshua is the same as the angry surgeon. You're going to ask them to sit down and you're going to very politely, take a very quick history. They're going to be reluctant. And whenever they interrupt you, let them interrupt you. If they have any concerns, you are going to validate their concerns. Please do not forget, I keep saying that again and again, do not forget to validate the patient's concerns. If if the patient asks you a question, you have to answer him. You're going to stop doing whatever you're doing to the patient. If you were talking about management and he asks you a question in between, you have to answer them. If you do not want to answer them then and there, you have to say this one line. Okay, I can see that you're concerned about this particular fact. May I complete, may I complete what I'm trying to tell you, and then we can get back to this later. Sometimes patient will interrupt you during taking a history. Okay, you're taking a history, and the patient like, doctor, what's going to happen to me? Okay, I can see that you're very concerned, but please let me ask a few more questions. I'd be very grateful, just let me ask a few more questions. Let me see what's exactly being happened here, and I will definitely get back to you on this once we're done with the question. Okay, there is a polite way of doing everything. GMC wants you to know that. All right. Okay. Yeah. So the Joshua case, yeah, it's the same thing. You just be polite. Let me just get to the last thing I want to do. Actually, you know what? You can. I remember the stations. I remember the stations. So sorry. There are certain stations with the medical colleagues. Sometimes it's going to be another FY2. Sometimes it's going to be a foundation year 1. The foundation year 1 station, he's going to be late. He has been coming in late a lot. All right. And so what you need to do is you need to talk to the foundation year 1 and ask him if there is any problem. So this is a colleague station. Colleague stations are very volatile stations. Colleague stations, you can fail in 1 second. So always remember, be very afraid of your colleagues. So in the FY1 station, the FY1 will come in, and what you do is you start the station off by, hi. You don't say my name is Dr. this, Dr. that. He knows what your name is. He has been working with you for around 6 months now. He knows what your name is. So please do not be like one of my friends and sit inside the station. Hi, my name is Dr. this. So what brings you today? He's like, doctor, I know you have been working with you for the past 6 months. Needless to say, he failed the station as well. So don't do the common mistakes that human beings do. If you've reached PLAB 2, you're more than human beings. You're PLABers. It's a separate class. So you start talking to the FY1. What you do is you say, hi. As you know, I have called you here today to discuss something. But before I do that, how are you? How is your rotations going? How is the work and how are the working conditions? You have to build a rapport with them. It's called building a reputation with your colleague and sometimes with your patient or sometimes with the student. So how is it going? Are you enjoying your rotations here? Is there ample opportunity for you to learn? Is there anything we can help you with? How are things generally? Are you enjoying your time in the hospital? Stuff like that. Just 5 or 6 questions, sometimes 2 or 3 questions would do. Okay. Yes, Dr. Sharia, I'm trying to turn the volume up. Sorry. I think there's something going on with the mic. I'm sorry. I'll just buy a new one tomorrow. So in these kind of scenarios, you start off with the greeting, you build up your reputation, and once you've done that, then you come on to the task at hand. So the task at hand is, why is he coming late? So what you do is you ask him. So I've called you here today to discuss something very important. I've been observing, there's something, happening. Is there something that you would like to tell me? He's going to be like, no, doctor, I'm not, there's nothing. What's wrong? Okay, you don't need to be, afraid. There is a, I just wanted to talk to you because I've been observing that you've been coming late. Is everything all right? Is there something that would you like to share with me? So then he's going to be like, doctor, I get pretty tired. The working hours are too much. I have to study with the duties as well. It gets really hard. So what you're going to do is you're going to find the reasons first, and then you're going to give him solutions. Okay, may I ask a couple of questions, just to get to the bottom of all this, maybe we can come to an arrangement. Maybe I can help you with anything. So he's going to be like, yeah, sure thing. So, when do you sleep? How are your eating habits? Are you drinking? Do you go to, sometimes people, they, after a very hectic duty, they go out with their friends. So do you go out with your friends? Do you go clubbing? And sometimes when people go clubbing, they like take one or two drinks. Do you drink? Okay, you just try to find the triggers. Once you found the triggers, you start giving him solutions. If he's sleeping late at night, you're just gonna advise him, okay, so what I want you to do is, I'm your senior, I've been working here longer. So my advice is that a good night's sleep is essential for you to work. It does not compromise your, decision-making powers, and you're active. Try sleeping 1 or 2 hours earlier. Try having your dinner on time, stuff like that. It's very easy, but the starting and the history-taking part, that's going to be a bit, needed. That needs focus. Okay, then the last scenario, finally, a colleague that has, you have, the scenario goes like that you were at a hospital party last night or at the weekend. So one of your FY2s, he's a colleague, or one of your seniors. So what he does is he is doing drugs and you saw him doing drugs. So now, what you do is you are going to confront him. So this is a very difficult scenario in itself. So if it's a senior, it's going to be help. If it's an FY2, that's going to be fine. So you can talk to him, on equal footing. So you went in, you go in, you start off like the standard colleague station. How is everything? How are you doing? How are the rounds? How is everything? How are things at home? So you're just going to do the reputation building. Once you have done that, you are going to ask him. So I just wanted to discuss something that I saw during the party last night. So while we were at the party last night, everyone was dancing, everyone was, talking to each other. There were songs playing. So I think I saw you, take something up your nose. Uh, he's going to deny it instantly. The whole point of this station is that he needs to accept that he has a problem. And this is a very problematic station because in 8 minutes, you're going to have to make him confess. And then you're going to advise him on how not to do drugs. So he's going to deny it outright, no, I don't do drugs. So what's going to happen is you don't just say, I saw you do drugs. What happens here is you start off by, so everyone was talking, and I heard some stories last night that maybe you were doing drugs. And, personally, I did not like this approach. I do not like the word drugs. So what I did was that, some people were talking around and they were saying, you were smoking something other than cigarettes, and there was some white powder stuff. So you just conveyed to him that you have heard other people say that he was doing drugs, and he's gonna be like, boss, how rumors are. People talk and talk and talk. I was not doing drugs. I mean, come on, how could I be doing drugs? And sometimes he won't respond like this. Sometimes he's just going to be simply offended. Are you saying I'm doing drugs? I'm like, I'm not saying that you're doing drugs. I'm just saying that people, they talk sometimes. And I've heard people say that, you putting something up your nose. I don't know what that is. So he's going to be like, no, boss, I was not doing it. So once he denies it, then you're going to go full circle on him. Then you're going to reveal that you have seen it as well. So, if it was only other people talking, I would not have called you here. I would not believe them. Obviously, rumors are everywhere. The whole point of me calling you here was the fact that I saw you with my own eyes doing those things. And then there's going to be pin drop silence for a few seconds, and he's going to be like, okay, so are you going to tell on me? Are you going to tell the consultant? Then you're going to go on the counseling part. Okay, so no, I'm not going to tell the consultant, not now at least. I just wanted to know, I just wanted to find out, why are you doing this to yourself? Then you start asking him, may I ask you a few questions, the whole routine. Can I ask you a few questions just to, how much are you using? How often do you use? Do you use with friends? Where do you live? The people you live with, do they do drugs? How did it start? Stuff like that. Do you believe that you cannot live without them? Okay, the standardized stuff. And once he's told you all of this, then you offer him solutions. Okay, and then with a warning, you end the station with a warning. How do you end it? You end it by, okay, so I am not going to tell the consultant about this. I want you, I'm your friend, I'm your colleague. I do not tell on people. uh, so I do not tell on people. So uh, what I want you to do is, I want you to go to the consultant and tell him that you have done this. Then he's going to be like, but they will cancel my registration. They will kick me out of the hospital. No, the consultant is not going to kick you out. He's a very understanding individual. He will understand that, mistakes are made by humans, and he will help you. And we are all of us are here, we're with you and stuff like that. And that is how you end the station. That is how you tackle the station. Okay, so this is basically just a very I've tried to put in a lot of things in a very short period of time. Do we have any questions, guys? Does anyone want to ask anything? Let me just open the chat. Sorry. Yeah. Okay, guys. Does anyone have any questions? Somebody please say yes. No? No questions, really? Okay. Thank you, Joseph, for saying yes. Yes, it was going to be on the YouTube channel, I guess. Please contact Miss Mafia for that. And if there are no questions, please talk to Mafia about that, Joseph. Man. I'll be glad to teach you.
Excuse me, sir.
Yes, boss.
Can we call that actor sir or ma'am while discussing the case?
Yeah, sure thing. Sure thing.
Okay, thank you.
You can call them sir, ma'am, buddy, friend. Just basically start with Dr. This, and then you move on. Once you have built your reputation, then you can call them whatever you want.
Okay.
Okay. Okay, guys. I guess this is it. Miss Mafia, are you there? How many ethical stations will come in exam? I don't know, man. Shariar, I don't know how many ethical stations are going to come in the exam. Sometimes it's one. The most number of stations I've seen is 3. That was in my personal exam.
Yeah, thank you so very much, Dr. Daniel. It was a wonderful session. Thank you so very much. Students are very happy, and I'm happy too because students are happy,
Kind of works both ways, doesn't it?
Yeah.
Okay, guys. Well, if that's it, then I will take my leave.
Yes.
Okay, guys. Thank you very much for the session. Do prepare for your exam, and just Don't
Yeah,
prepare too
best of
much.
luck, everybody. Yes, but best of luck. We will share the recording of this session on their YouTube channel. The YouTube channel name is Med Exam Expert. You can search just by writing name Med Exam Expert. Even you can search on our page as well, or you can drop in a message on our Facebook page. We will definitely reach you out. Even you can drop in a message on my number I have shared in the chat box. Okay. Next session, for the next session, you have to message on our Facebook page, so we will guide you further. Okay, thank you so very much. Thank you so very much, Dr. Daniel and the backend team.
You're welcome. Thank you, Mafia. Thank you, guys. Thank you for the support. See you at a later stage. Bye-bye.